We have more breaking news now on the local fertility clinic failure that's making headlines nationwide.
The agency that accredits University Hospital's fertility clinic is now investigating after the malfunction in their storage facility left 2,000 eggs and embryos in question.
News 5's Tara Molina has been following this story from the very start. Tara, it's the College of American Pathologists behind this.
Yes, Rob, they accredit more than 8,000 labs nationwide and internationally. University Hospital's reproductive lab is one of them, now being investigated for compliance after what hundreds of families here are calling a devastating error.
This is a very, very unusual event.
Unusual malfunction leading to more than one investigation. I got on the phone with Dr. Paul Bachner, an advisor with the Committee of American Pathologists Accreditation Committee. He explained that a federal statute requires most labs be accredited by an agency like theirs, but not reproductive labs. There's no requirement.
They seek our accreditation voluntarily. They're not required to be accredited by federal law.
University Hospital's reproductive lab, one of 350 that elects accreditation. So it's mandatory they follow what the agency refers to as scientifically rigorous requirements.
They cover all activities of a lab,
including on-site inspection every 2 years. University Hospital's last inspection, April of 2016. But this investigation will come before their next scheduled inspection to make sure after the liquid nitrogen storage facility's malfunction left 2,000 eggs and embryos in question, that the lab is still in compliance. Dr. Bachner told me their first step for this investigation is a letter sent to university hospitals identifying relevant data, giving them 30 days to respond. But
still be in compliance even though there was a failure of a particular instrument or, for that matter, if there were human error involved.
I also just learned the College of American Pathologists also accredits the hospital in San Francisco that experienced a similar malfunction in their storage facility. They'll investigate their compliance as well.
Their last desperate hope to have children was to turn to science. Hundreds of couples now know for sure those hopes are gone. University Hospitals releasing a second letter to patients today revealing not only are all of the eggs and embryos affected by a refrigerator failure destroyed, but there were twice as many embryos lost than first thought. The letter explained this devastation happened because of human error. Somebody turned off the alarm that would have notified staff when the temperature in that storage tank started to rise. And 4,000, not 2,000, eggs and embryos were destroyed. That's 950 patients devastated tonight. We're going to get into that letter and talk about how patients are reacting to it in our team coverage. We start with 5 on Your Side investigator Sarah Buttison. Sarah, you just sat down with the man in charge. What did he have to say about all this?
He didn't have as many answers as we had hoped for, Rob. Dr. James Liu is in charge of the obstetrics and gynecology department at UH, which includes the Beechwood Fertility Center, where the massive malfunction occurred. During our brief interview today, he evaded most of our questions, but he did reveal some new information about how a single malfunction caused so many patients to have their dreams of having a child destroyed.
On March 3rd, the temperature rose too high inside a storage tank filled with 4,000 eggs and embryos. Today, UH said the alarm that should have alerted staff was turned off.
Whose job is it to make sure those alarms work?
The alarms are unfortunately not checked in this case prior to this event happening over the weekend, so I am not certain when this alarm system was tested last.
Even though Dr. James Liu is in charge of the department that oversees the fertility center, he also didn't know how often the alarms have gone off in the past, but did tell us, unlike some fertility centers, UH put every egg and embryo from its patients into a single storage tank, the one that malfunctioned.
Do you regret that?
Obviously, in hindsight, we do, and we feel that in the future we've gone back to the lower technology tanks where we would split essentially specimens between tanks for a given individual, if that is possible, obviously.
Why weren't you already doing that?
This is an event that we did not anticipate.
We wanted to find out how the failure will impact the fertility center's future. But watch as we're cut off by media relations strategist Mike Ferrari.
Why would any fertility patient want to come here?
Because we take good care of our patients as best we can on a case-by-case basis.
How can you say that?
We're good. We got time's in the essence of time here.
We then tried to find out who is ultimately responsible for the failure, but we're told our time was up.
Who do you blame?
I don't think we can blame anyone at this point in time until the investigation is conducted.
Are you to
completed.
Blame? Doc, we're done.
Do you want to see more of our interview with Dr. Liu? Go to our News 5 app. We've put our complete conversation online. I'm 5 on Your Side investigator Sarah Buttison.
Now a News 5 exclusive. Our 5 on Your Side investigators can now confirm University Hospital CEO Tom Zenti decided to spend some personal time in the Cayman Islands while a major fertility crisis was still unfolding here in Cleveland. 5 on Your Side investigator Jonathan Walsh first broke news of the trip and now has this update.
This comes after I first reported Zenti had left town for what UH called a business-related meeting. Well, we learned the trip for Zenti wasn't all business. A new email from the UH Board of Directors Chair Sandy Pianalto states that Tom Zenti, the CEO of UH, was in the Cayman Islands chairing a board meeting of the Western Reserve Assurance Company, or WRA, several days after UH discovered thousands of embryos had been lost because of storage problems at the Ahuja Fertility Clinic. 900 plus UH patients have been affected by this fertility clinic problem. WRA is an insurance company based in the Cayman Islands, and the company is a UH entity. 5 on Your Side investigators found public biographies of several senior UH employees, including Chief Legal Officer Janet Miller, who are on the board of WRA. However, despite numerous requests, UH refuses to confirm which employees were at the board meeting, the date of that meeting, and what date Zenti left for the Cayman Islands and came back to Cleveland. Pianalto also said that Tom further confirmed that he remained in the Cayman Islands through the weekend at his personal expense. Pianalto said Zenti engaged a team to care for the fertility clinic patients and assess the situation before he left Cleveland, and that Zenti stayed in contact with the UH team, working on the fertility clinic issues, and directed the team's activities while he was in the Cayman Islands. However, News 5 has heard from patients and others close to UH who question the decisions of Zenti taking any time away from Cleveland during a serious event like this. And we've learned, of course, there was personal time involved while he was out of town. I'm 5 on Your Side investigator Jonathan Walsh.
A massive failure breaks the trust of hundreds of University Hospital patients. Tonight, we're taking a closer look at the tank where their eggs and embryos were kept frozen and ultimately destroyed. After UH blamed a malfunctioning storage tank for that catastrophe, we tracked down the company that made the tank.
Custom Biogenic Systems says its tank worked just fine, and UH is the only one to blame here. So we sent News 5's Tara Molina to the company's headquarters in Bruce Township, Michigan, to get some answers.
Since releasing a letter to patients and cutting our interview with the head doctor of the department short last month, UH has been quiet. They've released no new details about the incident or their responsibility. So I took questions here to Michigan, where their equipment is manufactured, and got some answers that may explain their recent silence. Custom Biogenic Systems, headquartered in Bruce Township, Michigan, manufactures cryogenic equipment, cryosystems, freezer racks, and other tools for labs across the country and the world. Their name is on the storage tank in University Hospital's fertility clinic. The tank involved in what the hospital called a catastrophic failure. But according to the company, it was not their equipment that failed. They say it was human error. University Hospital's employees did not follow instructions. Custom Biogenic Systems staff will not go on camera with us at this time, but their information department released 3 pages of new details to me. Information further explaining the problems UH has admitted to. In this letter sent to patients, UH admitted they knew the tank needed preventative maintenance. UH admitted to filling the tank with liquid nitrogen manually. UH also admitted they did not even have that liquid nitrogen stocked. but were borrowing it from another lab. UH admitted they had a backup tank, yet hadn't transferred anything to it. And UH admitted the alarm, meant to alert employees to temperature swings, was turned off. But according to Custom Biogenic Systems, the manufacturer provided university hospitals with instructions for the maintenance needed on the tank. Quote, UH initially followed the instructions, but stopped that recommended practice at least several days before the incident, when there were no liquid nitrogen tanks available and UH staff started borrowing them from another lab. Quote, UH chose instead to use a container filling method to pour liquid nitrogen into the top. The last pour, the Friday before the weekend failure. But, quote, the tank is not designed to be filled by liquid nitrogen being poured into the top of the tank. The product manual stating, important, it is not recommended to attempt to manually fill. Quote, this is an incorrect fill method and will cause liquid nitrogen to come into contact with the stored samples. Also explaining, the unit does not and cannot measure liquid nitrogen that's poured in because, quote, liquid nitrogen should not be poured into the storage area of the tank. The company also says in its investigation, they determined when the temperature of the tank started to rise, the tank functioned properly, quote, indicating a high temperature condition and activating a local alarm. The alarm was turned off. And finally, the company reveals the extra tank referenced by UH was made available to them as early as August 15th of 2017. But UH didn't arrange for delivery until the end of October. It was delivered November 2nd. In the letter sent to patients, UH said they started the transfer process, but no eggs or embryos had been moved yet. They explained, quote, this process takes several weeks. But the hospital had that tank on hand nearly 4 months to the day of the failure. I'm waiting for my follow-up questions to be answered by the company. But in the meantime, I took this new information to University Hospital spokespeople and asked them to comment on this. I still haven't heard back from them tonight, but if I do, I'll include that in our web script. Reporting in Michigan, I'm Tara Molina, News 5.
Broken trust to a degree we never dreamed we might uncover. Fertility failures at university hospitals here in Cleveland led News 5 on a trail across the country.
It's hard right now to think that that is possibly taken away from me.
Our exclusive 5 on Your Side investigation reveals shocking details about just how often these tragedies happen.
Once we realized the scope of all this, we set out to get some answers about why it's allowed to continue. 5 on Your Side investigator Sarah Buttison's here now. And Sarah, you found cases that go back decades.
We did. From the tragic to the bizarre, we found accidents and mistakes involving fertility centers in every part of the country. Even more troubling, we also found there is no way for patients to find out about those disturbing failures.
And my parents just called me and said, like, you sitting down? I was like, yes.
In that instant,
And there was an accident that happened.
her dreams
And we think that all of your eggs that were retrieved were lost.
were destroyed.
And I just felt like really sad. It's like I don't know what it means for me with having kids.
It has been nearly a week.
The hospital is still denying
New information about the malfunction.
Regulations or lack of regulation.
That was their only shot.
Shouldn't have to deal with this right now.
Sierra Matthews is one of 950 fertility patients whose eggs or embryos were lost during a catastrophic malfunction.
They confirmed the medical misstep.
still denying interview requests
At University Hospital's Fertility Center in Beechwood in March.
They represented life and hope. And there was hope for me that if I wasn't able to have kids naturally, that I had this backup plan and safety net.
Her life had just returned to normal.
Flashbacks happened of everything that I had to go through.
At 18, she was diagnosed with ovarian cancer. After undergoing surgery to save her life, she decided to undergo treatments at UH to save her fertility.
It was very important to me to be able to be a mom because I want to be able to love my own kids.
How often do problems happen?
I think probably more than we think.
Brownie Lewis is a law professor at Cleveland State University and expert on reproductive issues.
But what they tend to do is report the success stories and not when there are problems.
In my 28 years of doing IVF, accidental loss of embryos or accidental destruction is something that's extremely rare. This is also on our alarm system.
Keith Whitaker,
this blastocyst,
is an embryologist.
It's starting to hatch.
At Northeastern Ohio Fertility Center in Akron, who has helped hundreds of people become parents.
What does happen is IVF is not perfect, and not every one of our patients gets pregnant.
But our exclusive 5 on Your Side investigation found close to 4 heartbreaking incidents involving fertility clinics around the country, going back,
I remember asking him if he was sure.
40 years.
If it was all of them.
In Beverly Hills, Marissa Yukich's embryos were accidentally thrown out.
They inadvertently destroyed all of the embryos.
What do you mean there's no embryos?
In Los Angeles, Natalia Bergman's simply disappeared.
They had to cancel the procedure because there was no embryos.
At that moment, we had no idea what the future was going to bring.
Even more disturbing, Ohio mom Carolyn Savage was implanted with another woman's embryo.
Within 8 minutes of delivery, we were handing off Logan to his parents, never knowing if we'd ever see him again.
There's no one in this world that has gone through this.
The most bizarre, this Texas case. Just listen.
Why would you go get pregnant without me?
A fertility lab gave Lane Hardin's sperm to his ex-girlfriend without his permission.
So I'm just asking the question of why, after we broke up, you went and got the sperm.
What should we learn from all of this?
We should learn that if we're going to continue letting medical technology create different ways to have children, we have to regulate it.
Our investigation also found there are virtually no government regulations for fertility centers. If you're a patient, can you find out about past problems?
No, it's next to impossible to find out about past problems.
Clinics only have to report success rates, like the number of babies born, to the CDC. Failures remain a mystery. Even critical components are self-regulated. No agency inspects storage tanks, like the one blamed for UH's disaster.
There's really no way for a patient to know what is going on at a fertility clinic.
What regulations are we talking about? Because we already have very strict standards. See the shiny liquid?
Whitaker took us.
If you put something in it,
inside his lab.
You hear it boiling off?
Embryos are stored in these 2 tanks, resembling milk bottles.
We measure the tanks daily.
Replenished with liquid nitrogen weekly to keep them frozen.
Whenever the tanks have been refilled each week, it's logged in.
And 1 minute after he opened the lid, an alarm blasted a warning.
It is not okay.
I wouldn't do anything different or act any differently if there was a law that governed what I do for a living.
Even if they say that they are rare, it's still something that is so horrible that happens. It shouldn't even happen at all.
Unlike many patients, Sierra's not sure she can undergo more fertility treatments.
I love kids, so it means a lot to me to be able to have kids.
After her bout with cancer,
I want to still be able to have kids in the future.
Her health is still at risk.
It's hard right now to think that that is possibly taken away from me.
Just to give you an idea of how much she loves kids, Sierra is a senior at Bowling Green State University. Her major, early childhood education. For an in-depth look at all of the cases we found, go to our News 5 app. It includes a database with detailed descriptions. I'm 5 on Your Side investigator Sarah Buttison.